Hello to all. I see many people coming into the webinar. Let's give them a few more seconds to join. Welcome to those that have joined meanwhile. We are already a great deal many. So it's very good to see so many people from all over the world gathered here with us today. If you'd like to tell us where you're joining from, please type it in the chat. We would love to know. My name is Magda. I'm the Executive Manager for the WVA. It's my pleasure to welcome you to this webinar. Today, we will introduce you to the new Essential Veterinary Medicines List for food-producing animals. WVA and Brooke will show you the aim and the functions of this new tool that we hope will be helpful for nations and regions alike, and for veterinarians and policymakers alike. This is the first list that addresses the medicinal needs of food-producing animals. It follows the structure of the WHO Essential Medicines List and adds on to existing tools, such as the WASAVA Essential Medicines for Cats and Dogs. It helps us go one step further in pharmaceutical stewardship and makes One Health a bit more attainable. WVA and Brooke will take you through what drove us to the creation of the list, through how you can use it and how you can contribute to its improvement. We'll be addressing some questions at the end, but please feel free at any time to type your questions in the chat, which we'll address at the end. Our first speaker today is Dr. Olatunji Nasir. He is the current chair of WVA's Pharmaceutical Stewardship Working Group and is also an ardent associations man. He has served as the vice president of the Nigerian Veterinary Medical Association, as president for the Commonwealth Veterinary Association. He's currently a member of the Veterinary Council of Nigeria and a member of the WASAVA Education Committee. Olatunji, let's hear from you.
Yeah, good afternoon, everyone. And thank you for joining us today. Today is a very good day for us as we embark on a journey to explore an essential initiative in animal healthcare, the Essential Veterinary Medicines List, EVML, created through collaborations between the World Veterinary Association and the Brooke Action for Walking Horses and Donkeys. The EVML represents a pivotal step forward in ensuring global access to essential veterinary pharmaceuticals. Let me acknowledge contributors, those who have made today happening. Before we delve into the specific of the EVML, I want to express my sincere appreciation to all of them for having played a pivotal role in the development of this crucial initiative. This includes individuals from expert subgroups, international experts associations, the Brooke, the WVA staff, and the WVA working groups. Their dedication and expertise have been instrumental in shaping the future of animal health care. Next step. Allow me to also provide a brief overview of the significance of animal health care and access to veterinary pharmaceuticals, as well as the reason behind our involvement in this initiative. Animal health relies on access to safe and effective veterinary pharmaceuticals. Unfortunately, in many parts of the world, such access is very, very limited. Ensuring proper use and access in high-quality pharmaceuticals, along with appropriate oversight of ordering, prescribing, and dispensing, are common concerns for all stakeholders in animal health. Furthermore, access to quality medicine and technologies is essential for a well-functioning animal health system. Medicine and vaccines play a crucial role in disease prevention and maintaining the health and well-being of animals, leading to positive outcomes and effective treatments that foster trust and confidence amongst owners and the general public. It's important to note that veterinary medicines impact more than just veterinarians and animals. They also have implications for people and the environment. Next slide, please. let's look at the challenges in access that have been noticed over time. Animal health relies, like we said, heavily on access to safe and effective veterinary pharmaceuticals. However, in numerous regions worldwide, such access is severely limited. And this presents a pressing issue for all stakeholders involved in animal health, including veterinarians, farmers, and animal welfare organizations. One major consideration is antimicrobial resistance. It presents another headed problem for everyone in the world at the moment. And easy access to a wide range of antibiotics can lead to misuse and the development of resistance. On the other hand, limited access or unavailability of certain antibiotics can also contribute to resistance when the same ones are repeatedly used, thus striking a balance where a range of antimicrobials is available to the right people, used at the right time and in the right way. You will agree with me, is very, very essential. I would say the misuse of antimicrobials unquestionably contributes to the growing resistance crisis and shares responsibility for the rising human deaths due to resistant bacterial infections. Animal products are integral to the diets and livelihoods of billions of people worldwide, with veterinarians responsible for ensuring their safety. Inappropriate medication use or lack of access to essential vaccines can jeopardize the human food chain. And we think we all know that. Additionally, zoonotic diseases pose a very significant threat. Preventing disease in animals through vaccination and quality health care is crucial for human health, evidenced by the human death toll from diseases such as rabies. How do we address this? Next slide. Recognizing the importance of addressing this issue, the World Veterinary Veterinary Association, WVA, and the Brooke Action for Walking Horses and Donkeys embarked on a mission to create the first global essential medicine list for food-producing animals. Drawing inspiration from the success of WHO Essential Medicine List and the World Small Animal Veterinary Association Essential List for cats and dogs, this initiative aims to provide a comprehensive solution to challenges surrounding veterinary pharmaceutical access. What is the list? Just like this present slide is saying, what is the list? One, Brooke and WVA jointly define essential veterinary medicine as those that satisfy the primary health care and welfare needs of food-producing animals. This includes veterinary medicine and vaccines. WVA/Brooke 2024. Number two, global relevance. Why globally relevant? The list is particularly valuable for nations facing limited access to veterinary medicines, hindering quality and animal healthcare provision. Three, its purpose is to serve as an evidence-based blueprint upon which countries can develop their own context-appropriate list. So this serves just like a guide. You can do your country-specific list depending on what is available and what diseases are available in your countries. So number four, it should be noted that the list is not intended to be a comprehensive compilation of all veterinary medicines. In this context, however, food-producing animals includes working livestock, which play a pivotal role in the production value chain of food. Next slide. Objectives of the Essential Veterinary Medicine List, and there are four basic ones. Number one, to assist countries in ensuring the availability of essential veterinary medicines on a global scale. Number two is to be applicable universally, catering to the diverse needs of different regions and countries. Number 3 is to support the process of self-evaluation, registration, and licensing of veterinary pharmaceuticals, thereby facilitating regulatory oversight. And last but not the least, it is to facilitate the regulatory oversight of veterinary pharmaceuticals. Next slide, please. Next slide. So what is the aim? The list of essential medicine is not intended to define exactly what medicine should be available, that should always be available in every clinic. No, that is not our intention, or the field kit, so to say. But veterinarians should be able to assess these medicines within their health system if required for the presentation and treatment of specific disease conditions. Sorry. The list, like I said, is intended to be a guide for countries or regional authorities to adapt and adopt. Depending on, or should I say to adopt and adapt, that is more, depending on the local priorities, conditions, and treatment guidelines, and to enable the development or updating of national essential medicine list. The list can also support registration, streamlined procurement, and distribution of sustainable sources of quality assured veterinary medicine. The list is not intended to be a formulary or compendium of all veterinary medicines. Many countries globally will have access to a far more extensive range of regional products. Essential medicine lists are only those needed to provide primary health care. The definition of essential veterinary medicine list were based on a similar list of essential medicine in human medicine by the WHO and the equivalent list for cats and dogs made by WSABA or SABA. The presence of a medicine in the essential medicine list carries no assurance as to the pharmaceutical quality of products containing that medicine. It is the responsibility of the relevant national or regional drug regulatory authority to ensure that each product is of appropriate pharmaceutical quality and that, when relevant, bioequivalent products can be interchangeable. The list does not include information on dosing regimen, drug interactions, contraindications, or potential adverse side effects. It does not include information on monitoring, record keeping, disposal, or storage of the medicine. This we have to let you know, and we're emphasizing that. Next slide, please. The development of the EVML followed a meticulous process, which I think you want to listen to. Number one, there was a creation of species-specific expert working groups comprising of professionals with diverse geographic and academic backgrounds. Number two, conducting comprehensive reviews and evaluations, including initial reviews, feedback from the WVA members and stakeholders, and subsequent revisions. And number three, the publication of the finalized EVML was done, phase 1, and took about 6 months for people to comment on this. So it was an extensive work that was done. Number 4, creation of specialized committees to review and update the list each 3 years. Slide 9, which I think will be my last slide for this introduction. As the main goal of the EVML is for every country to create and update their national essential veterinary medicine list, it serves as a foundation for addressing prioritization, availability, and accessibility of veterinary medicines. However, achieving this goal requires more than just the existence of this list. It demands extensive communication, partner involvement, and preparation of models for national use and adaptation. Having outlined the background and objectives of the EVML, we now invite you to delve into the intricate process behind its formation and invaluable insight gained from surveys conducted throughout the project. Shireen Williams, Global Animal Health Advisor, vet at the Brooke, has done a lot for this project to see its fruition today. I want to say again that she is a Global Animal Health Advisor vet at the Brooke Action for Walking Horses and Donkeys. With her extensive experience and passion for improving the welfare of walking horses and donkeys, Shireen has been instrumental in shaping the EVML project. And I will repeat that. Shireen has been instrumental in shaping the EVML project. Our insight will provide invaluable context for the process behind the list's formation and the significance of the survey result. Without further ado, Shireen, the floor is truly yours.
Brilliant. Thank you so much. And thank you for the introduction and sharing such a great oversight of the project so far. So yes, as mentioned, my name is Dr. Shireen Williams, and I've been the project coordinator working on this list since roughly 2020. Do you want to go to the first slide, Megan? Thank you. So a small bit about Brooke and what brought us to this partnership. So we're an international animal health and welfare organisation and work across Africa, Asia, Latin America and the Middle East. And we have programmes in animal health, welfare, community development and advocacy. We have an office in London, but the majority of our technical expertise sits with our veterinary and welfare teams within the field. Our animal health work really focuses on health system strengthening, of which practitioner competency and access to medicines are a huge part. And we focus on workplace mentoring using our unique animal health mentoring frameworks and training of local animal health practitioners. So that could be veterinarians, veterinary paraprofessionals, and agropharmacists, training them on the job while they treat animals or dispense medicines. And this gives us a unique insight and data on animal health at the last mile. So what this data, alongside the experience of our teams in the field, has showed us is that for the more than 4,000 practitioners that we work with globally, half of them, despite our team's best efforts, do not have access to basic veterinary medicines. So what does that actually feel like in the field for these vets and veterinary paraprofessionals? Well, vets are treating complex and difficult cases with only a handful of medicines and very few diagnostics. They're seeing sick and injured animals and owners who desperately rely on these animals for income generation, daily nutrition and essential transport. And in areas where access is severely restricted, we often see a cocktail of a steroid, an antimicrobial and an anthelmintic given, and sometimes this can be as a one-off. We also know that animals are not getting better. Owners are losing trust in veterinarians, and that globally we could be contributing to the risk of antimicrobial resistance where this type of practice is taking place. So we wanted to understand if this was an issue that was unique to our work, or that if it was present in the wider veterinary community. So that's why in 2021, we joined forces with the WVA to try and understand more about the global veterinary community's experience in accessing veterinary medicines. So we launched a global survey, which was shared in 4 languages and had more than 700 responses from 36 countries. And we're pleased to share a snapshot of those findings with you here today. Next slide, please. So staggeringly, 80% of the respondents felt that challenges in accessing veterinary medicines restricts vets' ability to address animal health in their location, with 1/4 of those noting veterinarians were greatly restricted. Next slide. And so 15% of respondents did not have access to pain relief. And veterinarians in 10 different countries all reported an unavailability of NSAIDs. For us, this statistic goes beyond even relieving pain and suffering, as it is our experience that where pain relief and anti-inflammatory medicines are not available, there is an over-reliance on medicines that are, such as antimicrobials and anthelmintics. So we must consider that for antimicrobial use to be minimised or further restricted, sorry, just might need to move. Apologies, obviously sitting too still. Sorry, so we must consider that for antimicrobial use to be minimised or further restricted, veterinarians must have access to other essential medicines. Next slide, please. So more than 1/3 of the respondents said that they did not have access to the essential medicines to perform humane euthanasia. So if we consider many of the reasons that food-producing animals are euthanized, we can also see that this is a One Health issue and risks the spread of infectious and zoonotic diseases, while also diminishing from the critical role that veterinarians play in ending an animal's life in a respectful and humane way. Next slide, please. So 34% of respondents reported a lack of access to vaccines. So worryingly, foot and mouth, tetanus and rabies were all specifically highlighted. Also noted was a lack of access to anaesthesia, sedatives and analgesia. And so at the heart of veterinarians' oaths all around the globe is a pledge to uphold animal welfare and minimise pain and suffering. So we can imagine the very challenging scenario for many vets around the globe. In addition to this, our responsibility for prudent use of antimicrobials and public health. Next slide, please. So respondents noted affordability, availability and self-medication by owners as the biggest challenges in accessing essential medicines and vaccines. Next slide. So interestingly, when we asked vets if their country had an existing national essential veterinary medicine list, 80% either thought that they didn't or weren't sure, suggesting that despite the clear need for improved access to medicines and vaccines, this critical resource either does not exist or is not known about. Looking to human health, the WHO estimates that 2 billion people do not have access to essential medicines, effectively shutting them off from the benefits of advances in modern science and medicines. And considering that advances and investments in animal health often lag quite far behind human health, we would estimate that a great deal more animals do not have access to essential veterinary medicines. So the WHO developed the term essential medicine and published the world's first model list in 1977, and it has been updated every 2 years since. However, within animal health, there's no equivalent definition or central medicine list, and currently no mechanism for countries to self-audit or report on the availability of quality veterinary medicines and vaccines. And this is a gap that we have come to feel needs to be filled as the first stepping stone to improve access where it is needed most. Next slide, please. So Brooke and the WVA first agreed that large ruminants, small ruminants, equids, pigs, poultry, aquaculture, bees and rabbits should be included within the list for food producing animals. So this is not intended to be a formulary or a compendium of all veterinary medicines, and essential medicines are only those needed to provide primary health care. These should be selected with due regard to disease prevalence and public health relevance, evidence of efficacy and safety, and comparative cost effectiveness. In essence, these medicines should allow veterinarians to provide proper preventative care and treatment to the most frequent and important diseases for food-producing animals while maintaining a high animal welfare standards. We also have two categories within the essential medicines, so core and complementary. The core list should be seen as the minimum medicines needed for primary healthcare services, where complementary category may include medicines for which specialised diagnostic or monitoring facilities or specialist medical care or training are needed. And crucially, as mentioned, this is designed as a model list to encourage development or updating of individual national lists, considering that country's context. Next slide, please. So how did we go about building the list? Well, as mentioned, we advertised for experts in the 8 species and encouraged veterinarians to apply through a formal process. From the applications, we formed 8 working groups, which contained 4 or 5 veterinarians who were selected based on their qualification and experience, but also took into account geographical spread and gender. They then worked incredibly hard, all remotely, over multiple time zones to form an essential medicines list for that species. But due to the scale of the project, we then phased it. So we decided to focus first on large and small ruminants, pigs and equids. And it is very important to us that while the lists have been built by species, the overarching list should be multi-species, as we know that many veterinarians treat more than one species when it comes to improving availability, there really is strength in numbers, and it's beneficial to see where one medicine is considered essential for multiple species. Next slide, please. So these lists were further reviewed by WVA members before we moved to an external review, where we enlisted the support of the global species organisations to review the concept and contents of each of the lists. So overall, the comments were really positive, and a small number of amendments were made to strengthen the list. And then I had the mammoth task of amalgamating the species list into one central list for food-producing animals. These were then shared with the World Organization for Animal Health, their antimicrobial resistance and veterinary products department, who reviewed the list with a specific view to align with the WOA recommendations on prudent antimicrobial and anthelmintic use. And this really brings us very much up to date. It really has been an enormous task, and I have felt a great deal of personal responsibility to ensure that this is a quality, evidence-based, practical resource that we know is so desperately needed, and to do it in a consultative and inclusive way. This list is really the product of incredible global veterinary expertise and also passion and commitment to improve animal welfare. To those of you that have lent us your expertise and your time, which I imagine was on top of your very busy professional roles, and to those of you who took the time to review the lists, thank you so very much. This really would not have been possible without your enthusiasm and dedication, and also to WVA colleagues, those here on the webinar, but also those who came before you. And thank you to my wonderful Brooke colleagues for your contributions and unwavering support. And next slide, please. So it's with great pleasure that we can now share the Essential Veterinary Medicines List for food-producing animals phase 1 with you. So this list contains 270 medicines in 11 categories, such as antimicrobials, vaccines. So the categories include antimicrobials, vaccines, hormone therapies, to name just a few. And this is now available in a searchable e-tool and will be a downloadable PDF in due course. We are now incredibly happy to share this list publicly and open it for consultation for the next 6 months. And we hope that you and the wider veterinary and scientific communities will engage and use the list and provide feedback for how we can further strengthen it. And over to my colleague Yvonne, who will show you around the tool.
Okay, hi everyone. Hope that you can see it properly and you can see finally the list on the screen. Okay, then as my colleague has presented, the Essential Veterinary Medicine List is a model list that aims to assist countries in ensuring essential veterinary medicines availability. And we have made it available for everyone in this online database that you can see on the screen now. The first thing that you can find here is about the founders of the Essential Veterinary Medicines List, which, by that moment you already know us. You can also see about the Essential Veterinary Medicines List, where you will find an overview, background, the aim of the list, criteria for selection, and where is core and complementary. All of those things have been presented by my colleagues, but it's also available in this part of the tool. You can also find here at the end the terms of use and the copyright. The list is free to use and you can always use it and share its content. Just please make sure to properly set it as it's shown here. Then moving to the list itself, you can see the first thing is that we have a search button where you can type any medicine and it will appear here if it's in the list. Then you can see on the left that there is a filter, three filter option. The first thing is that it is organized by the species basis, and now you can see currently those from phase 1 as Serene has presented, and it showcases multiple types of medicines alphabetically organized. So if we select, for example, large ruminants and we apply the filter, we'll find here the list for large ruminants. But we can also filter it by core and complementary, as has been shown. So for example, we filter by large ruminants, also core, and then we have the type of medicines. All these types of medicines, for example, we take anti-inflammatory and apply filters. And we'll have here the list of essential core anti-inflammatories for large ruminants. Once here, if we open each of the medicines, we'll have the medicine type, the description that you can access better here, the animal's species that it applies to, and also the category, core in this case, as we have filtered. Finally, this other comment, the Essential Veterinary Medicines tool will be always available for free use and it will be regularly updated. Now, as my colleagues have mentioned, we'll start with a commenting period of 6 months, and this will be done through this add a comment option that is shown, and you can share your comments on each of the medicines. Moving forward, a committee will be formed to review the Essential Veterinary Medicine List. It's 2 to 3 years. This way, we will ensure that the list remain relevant and accurate and reflect the current veterinary practices and guidelines. We highly recommend that the Essential Veterinary Medicine List remains dynamic and actively maintained to serve the evolving needs of the veterinary community.
We come to the end of our webinar. Thank you so much for joining us today. We're very pleased to be able to introduce you to the Essential Veterinary Medicines List for food-producing animals. And thank you also for making the session so lively. I see that the conversations will continue even after the webinar. We hope to receive many comments through the platform itself and that this list will be helpful for you regionally and locally. And we wish you a very pleasant day.